plan of treatment would be to do a lipo-abdominoplasty. Okay. So lipo-abdominoplasty will be done on the liposuction will be done on the abdomen and the flanks and the lower. After finishing the liposuction, we will do the abdominoplasty to a lower incision, and where we take off all the unnecessary skin, unnecessary fat, and we also will prepare the abdominal wall. So we will lose and before protein. And the umbilicus, which is lower down, is push. So this will be surgery. Surgery will take around 45 hours of and the complications or side effects of this surgery. Usually, I'm telling you all the things which I've little hints. When I talk about 99% of patients still have these pain, of which we are going pain relief. And it might be there for discomforting, but it keeps supplementing. Everybody who gets this procedure will bear it and will have reasonable post-operative. Okay. Swelling may not be seen immediately, but after maybe 1 to 2 days, you will start noticing some swelling. Okay, some swelling. And swelling will become hard. That's the next thing. The whole thing becoming hard. That's called induration. Now post-operative event. Okay. Don't worry about this also. And gradually with massages, which we will teach you how to do, the swelling, everything will come down. Right? Irregularities. Suppose మనం రోడ్ సైడ్ ఎట్లా పడితే పడతాం అనుకోండి, we have fallen on the face, but one will be looking swollen, one will be looking less. ఇది కూడా అలాగే. Some parts might be swollen, some parts might be less. So irregularities, don't get worried. Because when we do accurately on both sides. We do 5 grams here, we do 5 grams. We cut here, this one 7 cm, we cut here 7 cm. But because of swelling, there is a fault of irregularity. Don't worry about it. All that will be the use of massages and doing some amount of walking. Right? Then numbness. Because we are removing the skin like this, so the nerves which come, they get cut. But once I put it back, the nerve will slide and start flowing to the skin. And you get back your sensation 100% by maybe around 2 minutes. Right? So these are the most common things which you find. 99% will have all these. Aircraft, aerosol will tell you seat belt, life jacket, but have you ever put on your oxygen mask? This is also like that. So not to scare you, but just to say that this is a part of our consenting. Okay? So it's like a very safe procedure, and I'm sure you love the results. I am more than you. I think I am wanting to do a good job. Okay? Right?
Thank you.
Okay.